My name is Paul Amundsen. I am the Vice President of the AAPD Foundation. We are the nation's largest dentist-led charity dedicated to child oral health. It's a pleasure to be here. We're really thrilled to be working with the DTA Foundation and also Kids Community. They have been a terrific organization for us. We focus on access to care initiatives that help provide dental care for kids that come from families that can't afford it. And Kids Community was one of our early single-year grantees of $20,000, and Dale and her team have done terrific work over the years, and we're really thrilled to be here to talk about this initiative that the AAPD Foundation and the DTA Foundation are doing together.
And I'm Dale Gorman with the Kids Community Dental Clinic. So we are a community clinic, a nonprofit that solely serves low-income families.
Well, my name's Anna Gomez, and I am the dental clinic manager.
Well, I met the last time we were in Chicago for the midwinter meeting, and we talked about how during COVID we were doing drive-through fluoride campaigns so that the kids would at least have some sort of care as everything was closed. And parents were happy to drive through, and several of the preschools were hosting hearing testing, dental screenings, and then they got diapers as they exited. And that was a big draw. We had 182 cars in one afternoon, and we were able to provide age-appropriate oral health instructions at every car window. So driver, parent, grandma in the front seat, teenager in the back seat, and 3-year-old in the car seat. And we would offer them fluoride treatments, and if they said yes, we did fluoride treatments, and off they'd go. And so we were talking to Paul, and we were saying how the need for adults is really great, and there's not much help for adults. So he had an idea of saying, why don't we partner together and talk to other people and get some matching funding? So through those informal conversations, we formalized a plan, and Paul helped us through it.
Well, and a lot of it has to do with this guy. Because he wears at least 100 hats that I'm aware of, and a couple of them relate to both the DTA Foundation and also to the AAPD Foundation.
So my name is Kevin Thomas. I've been fortunate enough to have been in a role with the Dental Trade Alliance years ago to help focus the organization on access to care. About that same time, joined the AAPD Foundation and went through one cycle on the board, and then recently came back to the board as you were granted the award. So as we started looking towards other initiatives, got to DTA to say, how about we just do a handshake between the two organizations to see what we could do. And that's what I think has come from this. So it's been two great organizations doing access to care that have come to a great partnership.
And you knew of us because you help us with products, SDF,
Yeah.
that is a game changer for many young children.
And I think one of the things too is that where we're fortunate is that between the DTA Foundation and the AAPD Foundation, that we're all into access to care. We focus on children. We can't do anything that involves anybody over the age of 21. At the same time, when we had this opportunity, and you described the drive-through experience, and I can't even remember the order of events, because the other thing that Dale is excellent at is she's always walking around with some photographs and other things
Yes.
that are going on, and she was working her magic at the midwinter meeting in Chicago last month, and that's really where this all started. So, and now here we are with both organizations each putting up $75,000. The DTA Foundation's earmarked for the care of adults. The AAPD Foundation is earmarked for the care of children. And intuitively, we know what this is going to mean, but we're really looking forward to seeing the data that actually shows when care is available for mom and dad, the care for the kids and the follow-up is even better. And that's really what we want to see.
So over the years, we've always had moms and dads and parents and grandparents ask us, well, where can I go? Through this grant, we're able to provide treatments and services for the parents. Because as a parent, you're always last. Some of them have said, I've never gone. One woman said, I have the mouth of a sailor. I've never been to the dentist. It hurts. She opened her mouth and, there's a big hole in her molar. She was the first one to go.
You have that one parent who lost her husband tragically.
Oh, yeah. So, left her with 2 young children, and I had never met her because I had only knew dad. So when she finally came back, she brought the kids in finally. She said, I know you knew my husband. He passed away. and now I'm going to be bringing the kids. She was just so depressed, She's let herself go, her health. And this was so nice to be able to offer her this program. She's fine taking good care of herself because she's got 2 young kids to take care of.
Picture.
Yeah,
Yeah.
Of course you do.
Yeah.
Yeah, the only thing I would add is one of the things that we like to emphasize is that, from the APD Foundation's perspective, it's really the grantees, it's the grant recipients that are doing the work. But to be able to work with folks across the country like this, whose hearts are in a great spot and will do anything for their patients and their care. And we're actually tracking 3 specific things and outcomes as it relates to their no-show rates, their follow-up, are they showing up for their recall appointments, and then what's their carries at recall situation. And so what's nice is with Dale and Anna, if whenever we want to try something, their initial action is, okay. So, it really is a great place to be. So, and we're thrilled again to be working with the DTA Foundation on this.
So I'm very proud of the cooperation from the DTA Foundation to the APD Foundation. I think it's a great marriage for young and old, so it's perfect.
And through collaborations, you can do so much more. We're so much bigger than ourselves when we collaborate. And we're grateful. We're grateful to be able to serve these families, and they're very fortunate, and they feel fortunate.